For esophageal gastric cancer, we have three top stories at ESMO 2019. First is the efficacy of an immune checkpoint inhibitor in metastatic esophageal squamous cell cancer, which has been demonstrated in the ATTRACTION-3 study. Second top story is the focus on health-related quality of life, data extracted from the KEYNOTE-62 study, which compare immunotherapy with chemotherapy with regards to health-related quality of life. And the third top story is biomarkers in esophageal gastric cancer, and an analysis from KEYNOTE-62 re-emphasized the value of testing for MSI-high populations. ATTRACTION-3 is an important study, and why is it an important study? Because it shows for the first time that we have a new tool now to improve the survival outcomes of patients with metastatic esophageal squamous cell cancer. And this is a population in high need of better treatment results. This is an aggressive disease. We have very few drugs that are working, and it also was an understudied area. Usually, when we treat these patients, we start with a cisplatin and fluoropyrimidine-based first-line therapy, and this was exactly the population that was studied in ATTRACTION-3. When they were progressive on platinum 5-FU first line, they underwent randomization and were randomized to receive either Nivolumab, which is a PD-1 antibody, or standard chemotherapy, a choice between paclitaxel and docetaxel. And importantly, this study showed an improvement in overall survival with a nice hazard ratio. So it's a clinically relevant finding. And in addition to that, it also showed that Nivolumab was better tolerated than standard second-line chemotherapy. So the combination of better survival and better tolerance of treatment certainly will make it come into the standard treatment of this disease. There is maybe one word of caution which I would like to make. They studied a population that was primarily based in East Asia. The patients were based in Korea and in Japan and in Taiwan, and only 4% of the patient population was recruited in non-Asian countries. So we do not know exactly if these very, very nice results would translate to a non-Asian population. This is something that still needs to be discussed, but I would like to say that ATTRACTION-3 sets a new standard for the second-line treatment of patients with metastatic esophageal squamous cell cancer, at least in Asia. KEYNOTE-62 is a very interesting study for patients with advanced and metastatic gastric cancer. KEYNOTE-2 investigated what is the best first-line treatment for this patient population, and it compared an immunomonotherapy with pembrolizumab versus chemotherapy, which would be our current standard, a combination of a platinum compound and fluoropyrimidine. KEYNOTE-62 also had a combination arm of pembrolizumab and chemotherapy, but we did not hear news about that at ESMO 2019, so I will focus on the comparison between pembrolizumab and chemotherapy. We saw earlier this year that there is not a significant survival difference. The primary endpoint was to show non-inferiority for pembrolizumab versus chemotherapy. This was met, but it didn't really look like an important survival difference. And what we saw here at ESMO 2019 was first, results on health-related quality of life, and second, biomarker results. And when it comes to health-related quality of life, we would expect that maybe with pembrolizumab, the immunotherapy, we see a better preservation of quality of life, less toxicity. So this would justify to use this drug instead of chemotherapy. But unfortunately, the results were kind of disappointing. And in terms of health-related quality of life, we do not really see a big difference between chemotherapy first line and pembrolizumab first line. So I would conclude that in the summary, non-inferiority in terms of overall survival, but no better health-related quality of life, no better control of symptoms. This does not really make sense to replace first-line chemotherapy by pembrolizumab, at least not in the majority of patients. When it comes to biomarkers, you still can ask, what are the biomarkers that guide us the way in this balanced situation to go for the one or the other treatment? And we have seen important data on microsatellite instability status. The group analyzed their population for MSI-high, and in the MSI-high group we see a clear difference in favor of the pembrolizumab treatment. So this confirms earlier results that were taken from retrospective studies or from second, third line studies, where we saw already that MSI-high patients have a good probability to respond to immune checkpoint inhibitors, but this time it was shown in a randomized phase 3 study, first line, that the MSI-high subpopulation has much better clinical outcomes when you use the immune checkpoint inhibitor in comparison to chemotherapy. My conclusion is that we should test for MSI-high population upfront when we are starting to treat patients with metastatic gastric cancer, because we have seen so much better outcomes in terms of survival and also better health-related quality of life in this population. We have to be aware that the population is relatively small. Only around 5% of patients with metastatic gastric cancer would have an MSI-high status, but for them it is important to do a specific treatment approach.